count is really high today. Ed, you're always on that phone. Inhaler?
Jeez, Mom. I'm not a kid anymore. I wish there was an app for this.
Adolescence is a time of transition. Teenagers who crave independence begin to take responsibility. However, they're also learning adult skills such as organization. This can make it a very vulnerable time for adolescents who have an asthma diagnosis.
Patients oftentimes know kind of like, how am I doing in this moment? But they have less of an understanding of like, how have I been doing over the past week? So an asthma app that can help them to kind of check in and capture that information and then visualize it back to them is beneficial not only for them, but also for their physician to kind of better understand how they actually been doing.
There are 4 key components of self-management of asthma described in academic literature. The first component is symptom prevention. This can include avoiding certain triggers that aggravate symptoms as well as monitoring adherence to daily medications.
In the winter, when it's really cold and dry, it can be really bad. And then I know in the summer when there's a high pollen count, that can be really bad. And then just knowing how much activity I'm doing would, being able to track that as well, because all of those can be triggers for me.
Sometimes symptoms are unavoidable. In these cases, symptom monitoring is important to help recognize if symptoms are getting worse.
For me, it would be really nice to kind of be able to predict when I was going to have symptoms, because I know weather has a lot to do with it, and I know that some days when I'm playing soccer or something, I can really tell that my lungs aren't going well that day, so that'd be really helpful. And I know when I was younger, I often would forget to take my daily medicine, so I think for maybe younger kids, it'd be nice to have reminders so your parents didn't have to do it all the time.
Acute symptom management comes into play when symptoms reach dangerous levels and actions must be taken to improve them. In these instances, a patient may use a rescue inhaler and reach out to his or her doctor.
Patients that have chronic persistent asthma and are requiring kind of daily inhaler use, really what we want to be able to do is use their preventative medication to get them off their daily inhaler use.
In all of these situations, communication with important others, such as parents, friends, or primary care providers, are extremely important.
Since adolescents can frequently be found attached to their mobile devices, we developed our app for iOS, iPhone, using the Swift programming language and Xcode. In the beta of our application, you have access to the 3 surveys that will be employed. Upon initial launch of the app, you will be directed to complete authorization. Shown is our authorization via Apple Health. In addition to interfacing through FHIR with the patient EHR, patient data is written and read to the Apple Health system for easy access. Upon completion of authorizations, an initial survey will ask questions about your asthma management, triggers, social behaviors, and risk factors. We pull a patient's medications, provider information, and asthma action plan using Happy with FHIR. This information is integrated into the app for a personalized experience. Also shown is our daily monitoring survey, which asks a few questions about the current status of their asthma and reminds them to take their medications. Peak flow measurements can also be entered to track over time. The acute attack survey is to be utilized after a patient had an acute event that required the use of a rescue inhaler. This survey asks for triggers, risk factors, and symptoms. An option at the end of the survey asks the patient if they would like the data collected in the survey to be sent via direct message to their provider. All questions are saved as variables and put to the HR through Happy with FHIR standards. These are updated as an encounter resource each time a survey is completed.
Next, I will introduce how our app interacts with server built on FHIR standard. We use FHIR patient resource to store user information and encounter resource to store the check-in contents. Our app mainly uses the post request to upload data to our RESTful server and GET requests to download data from the server for dashboard visualization or other app functions. We use Swift to implement these functions. When users set up an account, a new patient resource is posted. We will automatically assign them a generated patient ID and use it to post the patient information to a RESTful FHIR server. Here shows the result of running this code. The status code indicates the connection status for HTTP request, and 201 means a successful post. Also, this request will return another unique patient ID on server. We combine this to our previously generated unique ID and use it in the GET request. To download a user's information, we use GET request. We use the unique patient ID on server to identify the patient and pull his or her info. Also, this HTTP request will return a status code, and 200 means a successful GET. For daily check-in content, we use encounter resource to store the information. The main process is completely the same to the patient one, except a new text string used for storing the check-in content. This text string stores all the user's answers to daily check-in questions, separated by space, so it's easy to generate and parse.
After we have beta tested our app, we will increase the functionality by adding current weather and pollen count using the Weather API. Our dashboard features this information, in addition to medication reminders and access to the surveys shown in the beta version. A data visualization is in the center of the app. It features the last 10 days of asthma metrics and allows the patient to visualize trends, enabling a patient-centered approach to asthma management.
Future work could also focus on integration of subjective exercise measurements and objective measurements, like heart rate and heart rate changes, with other wearables or the iHealth app. Since we want our application to be used regularly, we also want to explore strategies for gamification, which is the motivation for our end users to use the app regularly, and to further focus on the user experience and user interaction with actual end user adolescent patients. Finally, we would like to integrate a messaging interface within the app that can interact with a given electronic health record patient portal messaging system so that a patient can be kept in close contact with a care team.
This project has been an immense learning process. When we began this project in January, the team didn't know about FHIR or how to use the standards. We were not familiar with iOS development, Swift programming, or using JSON.
One of the most important takeaways from our work was to understand users' real needs. We learned to refrain from adding functions in the app just because they look cool. For example, we realized from our initial reviews and interviews that a shorter daily monitoring survey would improve compliance. To ensure that functions were useful to the patient and the information important to the provider, we interviewed both the patient and the provider. Having individuals with a variety of different backgrounds was a real asset to our project. On our team, we had a journalist, doctor in training, business specialist, mathematician, engineer, and public health professionals. Dr. Ed Hammond, our professor, and Dr. Jeannie McPick-Hens, a physician with informatics expertise, provided infinite wisdom and experience.
The SPiRE mobile application helps young people manage their asthma. Tailored application features are designed with the day-to-day needs of adolescents in mind. Electronic health record data paired with self-monitored data on behavior and symptoms help teens maintain independence while still sharing important health information with their parents and healthcare provider. This exchange of records, facilitated through FHIR standards, provides a unique and evidence-based precision medicine solution for treating adolescent asthma.